Well, good afternoon to you, and thanks so much for joining us here on Live at 5. I'm Dana Winklepleck.
And I'm Mike Tank. Two Knox County community members have been working throughout the summer to provide local leadership. It involves training on adverse childhood experiences, or ACE.
Yeah, ACE was a federally funded study that connected childhood trauma with long-term health and wellness problems for individuals. And as we move into fall, Will Price tells us how this training is starting to spread to other areas here in the Valley. Will.
Yeah, when Kelsey Carr and Bill Loffer walked out of their training back in February, both were unsure how it would be received back in Knox County. Now they are set to have hundreds of people trained by the end of the calendar year.
Adverse childhood experiences is one of the biggest public health concerns in the nation, if not the world.
Bill Loffer has lived in Knox County for over a decade. He says he's seen the effects of childhood trauma firsthand.
There is a need for all kinds of services in Knox County due to generational poverty, generational domestic abuse, generational drug abuse, generational alcohol abuse, all of those things.
Back in April, Loffer and Kelsey Carr began working together to offer free trainings for different organizations across the community. Their goal? Train 100 people by the end of the year. And Carr says they reached it in plenty of time.
We have trained over 100 individuals, probably across 12 different organizations, and they range from different paths. We have law enforcement, teachers, clergy members.
Carr says the best part has been hearing the feedback from community members afterwards.
It's been really heartwarming. The most common feedback that we get is people realize things about themselves. They say, wow, that makes so much sense why I do that.
And now they are expanding outside of Knox County. On Wednesday, Carr and Loffer presented to the Board for System of Care, a program with Good Samaritan Hospital. The program works in 4 counties around the area, connecting residents with different healthcare services. Coordinator Ashley Charleston says the presentation made an impact.
So I think a lot of the people that sit on our board had heard about ACEs, know what ACEs are, but maybe didn't have like real life examples of how they could integrate that into their work, into their home life, into the community in general. So I would say that's the biggest takeaway.
And Charleston is helping connect Loffer and Carr to other communities. Loffer had one word to sum up the emotion of watching the training spread across the valley.
Humbling. Humbling is a good way to put it.
After working with Charleston, Loffer and Carr say they have presentations set up in Pike and Martin counties in the coming months. And they now hope to train 300 people by the end of the year. The training can be done as a 2-hour, 1-hour, or 20-minute class, and it's free of charge. Dana?